Here. My name is Linda Perfetto, and it's my colleague Sarah White. We are both BOR employees right now. I had come to the BOR when it was actually the Board of Trustees for the community colleges at the time. In 2008, I was previously at Three Rivers Community College as faculty and program director for 8 years. So it's been, I think, 8 years that now I've been at the BOT first and now the BOR. So we just wanted to talk to you a little bit about some of the creative things we've done, sharing our experience with a common curriculum that joined 5 nursing programs together after 3 years of planning. We have now 11 years under our belts, which is hard to believe, to approach the community college system-wide approach to our nursing programs. We believe that many pieces and aspects of our accomplishments and our experiences can be replicated because we've had a lot of success, and we take pieces of it, perhaps part of our admissions approach, and replicate it for maybe an allied health program or whatever. So our goal is to help people learn what we do and put us out there as resources for questions. Probably the most pivotal lesson and experience we've had is finding the balance between what needs to be standard when you have a common curriculum at 6 colleges with 6 different cultures and common admission standards, and what is really based on the communities within which the colleges reside and the talents and skills of the faculty. So we've had a lot of fun with that. We've learned a lot from one another. So, as I said, in 2008, following the 3-year planning period, the program was implemented. We admitted our first class in 2008 at then 5 colleges: Capital, Gateway, Naugatuck. We've added Northwestern since that time, 2011, Norwalk, and Three Rivers. And we do prepare an average of 45% of Connecticut's RN workforce each year, and we prepare 63% of the associate degree nursing population. These students graduate as candidates for the NCLEX RN licensure exam for registered nursing. The initiative was originated through grassroots efforts of, at the time, nursing program directors and faculty talked about, we have 5 separate programs that are really doing very different and great things. A couple of the programs went through the summer. One program actually did 2 semesters in the summer, so the students had 6 semesters. One program had 4. One program had a 2-year wait list. So everybody approached things very differently, but we all had great outcomes. And in nursing across the state, we all get together across programs, across public, private sector, through our professional nursing education groups. Connecticut League for Nursing, which is a constituent league of the national. So we all knew each other. And certainly being all under the same umbrella of the 12-college community college system, we were well acquainted. So it came from the directors up to our then chancellor and BOT at the time, and they gave us the go-ahead, hired a consultant, and moved through a 3-year planning period. And we were, of course, guided by strategic goals, 7 of them, which I won't go with. And what we came up with is a common curriculum that was facilitated through the at the time, community college system common numbering course system. I don't know how many of you know about that, but the community colleges have common courses, if you will, common numbers, whereby the courses are 80% the same. So that kind of gave us a door in for NUR 101 is the same across. But we went a step further. We went with 100% the same, so all of the course descriptions are the same, the outcomes are the same. So we're 100% relative to implementation. As I said, we deal with the individuality of each community and faculty. As Another real important component of what we've done was centralized approach to nursing admissions. Sarah is the nursing admissions specialist. As I said, we're the two solitary BOR employees that, and we only had two ever, and we still have two. But we really have, it's, in a centralized initiative, as you can imagine, you need to have pivotal people at the center to coordinate the efforts. So Sarah works with admissions. You're going to hear a lot from her. We do have an infrastructure from the beginning of bylaws, program bylaws, which really aligns the group's administrative body, which is the Nursing Directors Council, made up of the 6 nursing directors and myself. I'm a director, if you will, peer with the nursing directors, so there are 7 of us now. And basically, the directors administrative, we work with student standards and practices, better known as policies. The BOR has policies, programs have standards and practices. So we, every year we change as needed based on responses from students, faculty, society, what's changing in society, how do we need to change what we do. The Nursing Admissions Committee, which Sarah is the chairperson of that and has representatives from each of the 6 colleges' admissions staff to plan, implement, and evaluate our approach to centralized admissions. But you think of our program offered at 6 of the 12 community colleges. We have students filtering from all 12 and as well outside of our system. So it's really a 12-college solution to these nursing programs. So we engage the 12 colleges, obviously more intensely the 6. The program committee is basically the faculty committee of which is curriculum primarily, and also student policies, and they oversee the entire curriculum, implementation, planning, and evaluation. So you can imagine that much of their work is guided by regulation for nursing programs, national accreditation guidelines, and what it is that our students need, how they're progressing, what kinds of changes need to be made. Over the 10 years we've done major, our accrediting body requires every 2 to 3 years a major examination of curriculum. So we've done lots of mapping projects. We get together a minimum of once a month. Usually I keep it to once a month. 6 colleges, 2 reps from each college come, and we usually have a very full agenda and work in between. So it's kind of neat, and where people come together and share a lot of their talents and practice so we can learn from each other. We have an articulation advisory committee. I'll talk a little bit about that, how we look at educational advancement for our graduates and students. And then depending on what initiatives we have going on, we have ad hoc committees that have started and task force that end when the job is done. So that's our infrastructure. And I told you we have 2 centralized leadership positions that oversee the whole shared governance, Sarah and myself. And again, acknowledging that individuality of the colleges and the commonality of what we do is the fine balance that we keep as facilitators. So some of the examples of the leadership activities, we have a very robust, it's very new and very exciting student outcomes database, which we'll talk to you a little bit about. We have 4,000 students since 2008 that we can look at from admissions to graduation and beyond, really supporting over the years data-driven decision-making. If we see a particular change in outcomes, we can examine it based on admissions criteria and compare, do we need to change something? We've probably made 2, maybe 3 admissions changes over the years, but we really monitor very closely the outcomes related to our admissions process. Obviously, Sarah coordinates the centralized admissions process with the colleges and the admissions representatives. Curriculum planning, I talked about that with the program committee. We also, nursing programs, like every other allied health program, are guided by state regulation. If we don't meet state regulation, we can't run a program. Things like mandatory pass rates on your licensure exams. For nursing particularly, it's 80%. need to pass the first time. Second time doesn't count. And if you're not meeting those benchmarks, you need to prepare a remediation plan and that. So our programs have always been pretty stellar with respect to that. We've been in the 90s, and we continue with that history. And national accreditation, each one of our programs are nationally accredited by ASIN. It's the Accrediting Commission for Education and Nursing, and that happens, unfortunately, on 6 different cycles. So there's lots that needs to be provided by us for those processes as well. So we do that. And educational advancement pathways as well are very important for us to maintain and to implement. Okay, so benefits of collaboration on the programmatic side. I've referred to what happens among faculty at our regular meetings. And really what's really cool is the sharing and the sidebar conversations that happen about what different, we have the course leaders from each of the courses get together and share their course level practices, and they really learn from each other and become more creative based on what their colleagues are doing across the system. And one of the biggest point of this whole thing is it minimizes duplication of efforts, and that was one of the very important tenets when we came together, because we had these 5 programs, each doing their own state board approval for regulation. We do that now together as one, and their accreditation nationally, they learn from each other on that, even though they are separate. Question?
A question about that, about accreditation.
Mm-hmm.
Because you have one way of admitting students, is there a relationship for accreditation, or are they totally looked at as freestanding programs?
National accreditation is freestanding. Only one of the biggest reasons for that is the governance structure of the BOT and hence the BOR. Each college has a president, so they're viewed as more independent entities. I don't know if any of you are familiar with the Community College of Rhode Island. They have a similar setup. They've got maybe 6 colleges that offer their nursing program, and they are under one accreditation because they have one. I don't believe they have separate college presidents, but they do go forth, and that was one of our 7 strategic goals, though, to have one national accreditation, and our accrediting body kind of, we thought we were going to be able to do that during the 3 years, and then we implemented. It was like, let us talk about this. So we kind of had a...
But I think your question has to do with admissions, whether that somehow conflicts with NIA standards. No, it doesn't, because you're not admitting the student, you're admitting them to a program. You're admitting them to a program, and the program itself has agreed to be similar. There's a lot of misinterpretation of our NIA standards. NIA doesn't mean that you have to free and do whatever. Mm-hmm. If there's an agreement that a program needs to be the same structure, the same way, then admitting to that program fits that model. Okay? Yeah. So I think that's the approach that they have followed.
But I think for accreditation too, they have a lot to lose, the accrediting agency, because you would pay one fee instead of...
Well, we talked about that too. I'm not sure. There was a lot going on at that time with our accrediting body. Things are changing now, and maybe we'll have an opportunity to do that, but it's working. It's a lot of work to do it 6 separate schedules, but it is what it is. Let's see. Okay, so leadership, we have referred to common standards and practices. We have one nursing student handbook. Obviously, policies, standards and practices, I'll say because they're not really policies, are written in a global way, so that implementation can appreciate the individuality of the college communities, their individual students for interpretation. But they're pretty well guided, and that is what happens among leadership as a focal point. And I keep saying consistency with individualization is key. Stakeholders, we work closely, as you can well imagine, with clinical learning sites, hospitals, community-based. And we are able to have somewhat a standard template for clinical contracts. That works out well. We're well identified as an entity throughout the state and the region and even the country, because we all involve in national conferences and such. So we do interact a lot because of educational advancement with academic partners and our professional organizations throughout the state and region, nation. So I'm going to turn it over now to Sarah, who will talk to you a lot about admissions.
So Linda had given a little background about herself. I have almost 19 years admissions experience. Yes. Oh, sorry. Thank you.
You.
This is the speaking. Apparently I can't talk unless I'm wearing it. So I have quite a few years of admissions behind me, and none in 2-year admissions. But coming into this, I found it really fascinating that we had this process where we could bring these 6 colleges together. And sort of navigating through all of this, first thing I learned was, yes, we have one way to do it, but there's really 6 ways. And it's a good thing that there are 6 ways, because it really allows for the flavor of the college, for needs within the community, and the mission we're trying to accomplish here to be served. So in terms of what it means for our students and the benefits, there's just one procedure for each process. We come up with a nursing information packet annually that is really the Bible for nursing admissions, and it gets online. All the colleges are going to be referring to it. We refer all students to it, and if it's not in there, there's probably nothing exists that has to do with it. So we would refer back to that for everything. So typically, all questions can be answered by going to the packet. It ensures that our students really have a fair and equitable process for admissions, which I think is very important that we are doing. You know, different schools employ different policies. It might be who barks loud enough, who calls enough, but that's not the case. We all follow the same set of policies. And in terms of that perspective on developing policy, when we come back to the table to discuss, you know, where do we need to make changes, that's when the individual colleges come forward to say that perhaps something isn't working, or we need to be more considerate of this particular area, and we can try to work that into how we are putting our admission policies out there. And that's kind of where you come up with this college autonomy within the established policies and practices. Linda and I are in Hartford. We're not at Capitol, we're not at Gateway, so it's left to the folks who are in those offices to work with students in the way that's going to work best for them in those populations. And again, that duplication of efforts, it minimizes it because they've got the one document to work from. And I will.
Can we stay together like this? I don't know if we should share this. Well, we wanted to point out, you know, as we sat and planned this presentation, you know, what are the advantages of us to be up at the BOR? There's lots of great resources up there, as there are at the colleges, but because we're a centralized program, it's important for us to be where we are. So we have access to the resources in the Office of the Provost, the Office of Research and System Effectiveness, as far as academics go. I have a reporting structure where I've reported to the Provost, to Estella. So she has me and I have her as far as the implications for these programs. Our Office of Research and System Effectiveness really has worked with us relative to the database that we've prepared. It was my dream when I walked up there. I sort of did this at Three Rivers to really track students, you know, what's going on, why, you know, we have attrition rates in all of our programs. Nursing attrition rates nationally are up to 50%. Ours have been about 25, because life happens. And since 2008, we've had, you know, lots of things happen relative to the economy and our students. They work too much, whatever. So I was really committed to getting this longitudinal database set up. It has been born, and we're even bringing in data sources from outside. So I'll probably talk a little bit more about that. The Banner student team, the programming staff, really integral, obviously planning our common courses, planning our, and implementing our application, which is all online. Go ahead.
So this is probably the one area that I feel like the colleges are really glad that we are so close, because everything we do with Banner, they're just down the hall. So when it comes to working on our selection process or the application, I have access to all this information, but the people behind it are right down the hall, so you can go down and say, this isn't working correctly. And that may not be the case if they're on the campus. So the fact that our system uses the same student information system and we can pull from it, we really are benefiting from this, having these folks right at our fingertips. And it's the same thing with communications, marketing, branding, website, walk right down the street and we can sit down and talk about the recruitment tools that we need. How can we revamp the website to meet our needs? As I said, all the colleges are directing folks to our website, which has put it, I think, second most popular in terms of hits for ct.edu, because everybody's going there for that particular need to meet the nursing information.
We've worked with the Office of Workforce Development, and sponsored programs, strategic partnerships to develop a grant this year and we chose our colleges based on our data. Who is the most needy relative to this particular call for proposals? And we'll hopefully have an announcement soon. It's a small grant, it's 1 year, but it can really help us establish some best practices with respect to underrepresented students. We all know Toby Crut, Blackboard. She's also up there with us. She's helped us a lot with components of our program that have been enhanced by Blackboard and our financial aid. Lots of contact with.
And it's so important for admissions.
Policies.
We push it all the time, and it's nice to have that resource and to know sort of what might be going on at the colleges as well, because they're in both places. We can talk centrally about what's going on.
Legal counsel, I was fortunate enough to share a wall with Tom Clark for 4 to 6 years, and when we were first developing our policies, he really had some great, his fingerprints were all over it, which was great when we were developing. Finance and contracting. Because we're one entity, we've been able to make purchases as one entity, standardized assessment for our students, that is a must for nursing programs. We get a pretty good deal when they hear we have about 1,200 students enrolled. They like that. And human resources, obviously, when we work on projects, we have lots of human resource things that tend to come up. More about admissions.
So in terms of minimizing and eliminating duplication, through centralized communication, I've developed my own communication plan. The colleges have approved how I'm moving forward with it. That way they can focus on their other recruits. Nursing students, many students are needy. Nursing students are needy. They want to be in this program. They put a lot of work into taking these prerequisite courses. They want a space in it. So they really do require a lot of attention. And that means on my end, I'm handling all the admission letters, all the ineligible letters, any emails that go out, our brochure that we use, our web presence. It comes in on my end, and then the colleges can benefit from just using those resources. In terms of the one online application, it's something through self-service. Currently, Allied Health at Gateway is also employing one, but it does not work in the same manner our online application works. So when you fill it out, you pick your first choice college. After you've finished filling it out and hit submit, you cannot apply to any of the other colleges. So you cannot have cross-competition of applicants. That is so helpful down the line, because when you admit students, you don't have one student admitted to 6 colleges, and then when they turn you down, you then have to find another student to take their place. So this was something that was very unique to me coming in. I said, what do you mean? You only admit for the number of spaces that you have. You don't build your buffer in knowing so many students are going to go elsewhere. No, you have a wait list. So in having the wait list, you know you're going to fill those spaces, and you know that every student is either going to be eligible and have a space, be on the wait list, or they're ineligible because they do not meet some type of criteria. So we're very clear throughout the process in communicating this information with them. But it also really achieves the next point. It gives you an accurate assessment of the demand for programs. How many students are interested in us? Past few years, 1,500 applicants, about 1,100 are eligible. We'll place a little over 500, about 500 go on the wait list. It's been consistent. There's a lot of demand, but there's reasons why we can't move forward with more spaces, but we know planning-wise how many students we're going to be working with throughout the cycle. And then, as I mentioned earlier, the technical aspects of the process, having them managed centrally really assists the colleges because then they don't have to worry about what's going on with Banner. I run reports, I get them their information, they will do some pieces on their end related to entering student file information, but that's what they would do with other applicants as well.
I have a question. So the decision, admission decision was made at the local level?
No, it's centrally made. Actually, I'll talk about the process that goes into that in just a few minutes. And do you want me to skip to that now?
Go ahead, if you want.
Okay. So when a student is eligible, it's because they have met three pieces of three criteria. They scored a certain level on the TEAS test, they have a certain nursing GPA, the 2.7, and then they also have achieved at least C+ in A&P 1. They're ranked if they meet all of these things and turn all their things in on time. And from that ranking process, we will select the first part of the pool is 75% is rank ordered. So if you have 100 students, first 75 are pulled directly from rank from that particular college. So if the student indicates that it's their first choice, they get pulled. Then, and this is the part that I really love about this process, everyone else who's eligible, who applied to that college, gets pulled randomly. We fill up the rest of those spaces randomly from the eligible pool. Because remember, they met minimum criteria. So what we do is offer them their space. Then everyone else would be put into the wait list in that rank order. So if a space opens, we call them in that particular order. And that's done in our particular office. So once the colleges have completed finishing their files, I work with them to make sure that all their ineligible applicants are all set, they've all had their communications, they know that they're out of this part of the process, and then we move forward with selection and release decisions through self-service.
Okay, so if, let's say there's some kind of local hospitals that favor a certain kind of candidate, and then the local institutions support that.
Yes,
How
there are
do you do it?
relationships like that. I can think of one situation at Gateway that you reminded me of, where Yale New Haven has really supported their program, their lab, and we have employees applying. Now, they need to meet the criteria, but we have ways of, and they're not selected specially or anything, but we identify them when they're on their way in. So, and those relationships exist in each one of the 6 communities. So the important part to remember is that the students select their college of first choice. So there are 6 populations of students for which this process runs. Okay, we don't have one, although the first year we did one overall. It didn't, our lack of experience, it kind of blew up because students that wanted to go to Norwalk might have been on the wait list, and they're from Waterbury, say. And it was very complicated. So the second year we did these community-based cohorts of students. So each college has their own wait list and their own group of students. We do have a process for second choice. They go to college of second choice. We've never had to implement it because if a college gets through their first choice wait list, then we can sort all the students that are left relative to college of second choice. And then we pull up the second choice people, but we've never have had to do it.
When students ask, I say it's insurance for us so that we know we can fill a class. Really for them, it hasn't happened yet, but they put a lot of thought into it, which is nice because they're taking it seriously.
Right.
So actually, that's another thing, which follows to what we're saying. I was doing institutional research at Gateway. So at one time, I was called into, this faculty actually was interested in improving the, what's that?
Accessibility?
The college, how to improve the course success. No. So
Okay.
one way
Retention.
Well, because also we have to do we want to raise the standard of the from a B- to the B level
Okay.
in college. So if that's the case, then you can raise our criteria of admission by T-score.
We are looking at that.
So, but anyway, that is the thing that you eventually could not do because somehow you cannot just raise the score at Gateway because,
No, right.
so, but basically, that was one way that you can do look at it, and
Sure,
then you
sure.
raise the T-score, and of course, your students better, and therefore the course success rate will be higher.
We have those conversations all the time. And then we have to balance it in the context of our mission of accessibility for all the students, the citizens of Connecticut, technically. So it's a balance. When we first started, we did 60% rank, 40% random, and we looked at outcomes. How are these students doing? The programs are costly. Would graduation rates increase? We're looking at hospitals in several communities that are supporting the programs. They want graduates. So we have to balance that, but we really are very committed to that random selection. And the T-score, as Sarah said, we're looking at that now, but I don't know that we're going to change it.
Yeah, because it would change who's going to be admitted. It's going to change that access.
Yeah, diversity.
And it really makes a difference.
Yeah.
Quick question on the fairness issue.
Yeah.
I teach a prerequisite course for the nursing program in Knoxville Valley, and the academic portion of it has created a little bit of a problem with regard to fairness. Oftentimes, it's more a function of who the person took for the prerequisite courses as opposed to anything else. In other words, if they know the easy shot through their prerequisites, they're going to beat out somebody that didn't do their research on rate professors and finding the easy shot through.
Yeah,
Quite honestly, that's
always
it.
exists,
We've
right.
had, better students knock it in because they didn't gain it. Right.
They didn't get the highest grade.
Exactly.
Yeah.
And so as a prerequisite instructor, I have maybe a B-plus student who I know is, super duper. But unless I give that student an A, you see what I have to
Yeah.
modify my grading
Unfortunate.
to game the system with everybody else. And
Yeah,
it's
it's
just not, the fairness is what suffers. And that's, I don't know, what would you recommend I do to make it fair for my
Certainly
students?
continue to do, what you're doing. You have to do what you do as a faculty.
No, but when I've gotten great students that I give a B+, and that's
Yeah.
the difference between them getting into the program and not.
Well, remember, we have the standardized assessment, T. So
Yeah.
if the student's great and well competent, qualified, they're going to score higher on that T's, and that will help offset perhaps a lower grade in
Right.
A and P.
And the nursing GPA that we calculate, that's 50% of this ranking process. So how well they do in their other courses is also going to be pulled in. And even though we have these minimums,
Yeah.
when we're ranking them and we look at sort of the average student coming in, the average GPA for nursing admissions is about, I think it's a 3.61.
Right.
So they have to do well across the board. And for A&P, it's a 3.5.
No, but for instance,
So-
our nursing advisor counsels students to say, you take this instructor, I've had some of my best students come to me and said, the nursing advisor told me to drop your class because I'm not going to get
Well,
an
that's
hour.
like the institutional.
I'm not sure. Yeah, we don't do anything with that.
I mean, I would say that the one thing that I've noticed since I've come in, and
Yeah.
I kind of learned this at an orientation session at one of the colleges, is I did not realize, and felt sort of ridiculous I didn't realize this, that each of the colleges has different prereq requirements to take A&P1. So I'm looking at this and I'm like, wow, so I had to come up with a chart, and depending on which college I'm at, you have to advise differently. And I find that really interesting, that it's even a different bio that you might have to take.
Yeah,
Absolutely.
we learned all that. In the beginning, we met, obviously, 12-college solution. Everybody needs to be at the table. The most difficult decision-making occurred with the sciences. We ended up, the best we could do was a choice of 3 prerequisites for Bio 211. And, that was in 2007, that was, decided, but it wasn't really put into policy, and we know it's other colleges that sort of eroded a little bit. But it's difficult because we need to work with all of our colleagues across the disciplines. And again, we know academic freedom, philosophy, all that with respect to all of us and how we work. So there are some, and as Sarah said, our common course numbering system doesn't allow for common prereqs. I suppose that must have been way too difficult back when they planned the common course. That was big enough.
Difficult, right?
How could you do that? You had a question.
I was just, it was around the same topic. Do students ever challenge you? Because they do work the system like this, and they figure, they try to, even picking their number one school is
Oh, there's challenges
Yeah.
all the time.
So
Yeah,
but do you
also.
get challenges back from students, because you're the one sending the letters, right? So.
No, the colleges.
Oh, they do, so.
It looks like, we do the kind of the legwork behind it, but they're signed by the colleges. But do we get calls? Absolutely.
Yeah.
Does Estelle get calls? Absolutely.
But not challenge beyond that, like it's never gone to someone sued you because they didn't get in.
So some people
I
are
don't
very
know.
insistent.
Okay.
Yeah. Some people are,
They do.
when I was in Nagatog, we had a case of somebody was very, and one can have a lot of empathy because they do want to study and there are other requirements. And the moment you make an exception, the whole
They all know
system
each other.
collapses. No, the whole system collapses.
Yeah,
You have to be sort of consistent.
Right.
So, yeah, they do challenge you.
And the importance of, we go back to that nursing information packet.
Yes.
We go back to our student handbook. And as long as the colleges are, enforcing and, playing by the rules, we're fine.
The only thing I want to mention about the slide that we did not cover is really that this is an annual application process. So you're applying for that year, that wait list is only for that year, you have to start all over again. So that is an important thing we point out to students, that it's unfortunate, but it will come up again.
And what took you back there, I wasn't sure if there's anything here that was a slide we skipped.
Oh, so in terms of how we can also minimize and eliminate duplication, so the colleges that do have nursing, they conduct their own info sessions. And at some of the colleges, it's nursing folks that do it. At some, it's the admission folks. It really differs per college. The 6 colleges that don't have nursing, I will go and visit. I come to Housatonic all the time. I get a great turnout, but it means sometimes I work with advising, sometimes it's admissions, it's kind of all over the board. So I will attend whatever events I'm really asked to go to. I was at an open house in Manchester. The first thing students say is, Manchester has a nursing program? And I said, no, but you can complete all your prerequisite and even your co-requisite courses while you are here. And it's really seamless if you get it. The other piece is that we have an established timeline that we all work with, and our group in the admissions, the Nursing Admissions Council. It's not just the admissions folks. We do have representation from nursing directors. We also have an academic dean on board, so that when we are having these discussions, other things are being brought or folded into what we are looking at when we make our decisions. And then at the end of the cycle, we always go back and review, what can we do better? How can we serve our students better? How can we communicate better? Because if there is a barrier in this, it's that I'm not with all of them. So as much as we work well together, we do want to keep the communication working as best as we possibly can.
Okay. Just a little more about our outcomes assessment. Again, prior to the database that we've just created, it's very new and very exciting. The prior nursing admissions specialist and I colleges would ask a question, or community would ask a question, we want to answer a question, we'd manually go into Banner and create these reports, and we really push the Banner student team with, okay, how do we do this? But now, under the leadership of Estella and Bill Gamble, we have this database that really Sarah is the expert with it. Okay, we want to know what the success rate of LPNs are, or younger students or whatever. We can pull that out because, as you all know, Banner, what's in there? We've got student attributes, and then we have performance in the course-based measures. We have standardized assessments that we do throughout the program. We can match that up with student performance in the course. What was their admissions picture when they came in? Have they been successful on NCLEX first time, or did they fail? What went wrong? What went right? And the most exciting thing that we're looking at now is educational advancement, and I'll talk about that in a second. But real, high-level integrity with these data. We can do individual college analysis, aggregate, comparing, whatever the question is, we seem to be able to answer it. So we're very excited. I talked about reports to colleges, the accreditation reports, and some of our stakeholders, employers, want to know information about our students and graduates. Additional benefits for students, again, you may or may not know this, but there is an emphasis on baccalaureate prepared nurses. Is anybody aware of that?
Yes.
Okay. So where does a community college nursing associate degree fit in? Well, there's national recommendations. Connecticut, as we know, is a very highly educated state with many colleges and universities. So we're a little bit of an outlier as compared to states like Montana, who really rely on associate degree nurses, and those nurses really struggle to find a place to go to get a baccalaureate degree. So the Institute of Medicine, huge hiatus in 2010, came out with a statement that was pretty much involved with many stakeholders, nurses. Institute of Medicine is not physicians, but it's just people that are concerned with healthcare, a federal group. And they came out with 80% BSN by 2020 was the recommendation, notwithstanding entry level, because we recognize that associate degree nursing programs provide diversity, opportunity, and those of you who are at the community colleges understand what we do for people in elevating their standard of living, helping them get an education that will hopefully translate into a more, an improved lifestyle. So we've had in nursing legislative mandates since 1992 that when nurses go on, remember the diploma programs in the hospitals that virtually gave really no credit back in the day. The more recent ones do, and I know Housatonic had a great relationship with Bridgeport Hospital. But in 1988, legislation passed where nurses, LPNs, RNs, associate degree, diploma, need not be duplicating any of that content when they go back for an academic degree. So that's all kind of written in. They get 30 credits for nursing if they're a diploma RN, and they should be getting 30 credits for general education. So we've sort of worked that with articulation where we've really gone above and beyond. We negotiate with our partner colleges and universities, to get even more than that, based on some of the coursework our students do. So we're very fortunate we had that articulation agreement throughout the state. Connecticut is one of 11 states that have that we could go back to when this whole emphasis on educational advancement came about. So I quoted you the statistics of how many nurses, percentage-wise, we prepare through the community colleges. There's no way that the state is going to turn back on that. We're too important. And we really create a graduate that stays in the state, our hospitals and facilities really rely on. And now with the educational advancement pathways and really getting them in the hands of the students is key while they're with us. And we do lots of marketing. Every year we have an articulation fair that Sarah runs with the partner colleges at each one of the nursing colleges where our partner colleges come and exhibit, talk to students about their educational advancement. Our CSUs are really stepping up to the plate, looking at dual enrollment kinds of things where when the student applies to the associate degree program, maybe they can also apply to Southern. So we're working on that so that we can plan, we can all plan for numbers. Obviously, resources are not unlimited. So some very exciting things happening there. We look at students and their goals. Do you want to be a nurse practitioner? If that's the case, then you're going to need to get your master's or DNP or higher. I think are we till 12:15?
Yes, ma'am.
Okay, so we're running over. We need to go. I don't think we have too much more. We do LPN to RN, if you're familiar with licensed practical nurses. That's another thing that came out of that statewide legislation in 1992 for LPNs. Again, they should not be duplicating their education that kind of overlaps with ours. So LPNs can advance place into the second year. We have a 4-semester program. They can advance place into the third. They go through the same admissions process, and they're admitted based on the process that Sarah explained. Great MOU with the Connecticut Technical High School programs. But they're different than our generic students, and we kind of know how to work with them. And then they can benefit from all the other educational advancement that the rest of our graduates do. So this is our last slide, and what does the future hold? We're constantly assessing our programs moving forward. We're in the midst of a current curriculum transformation. It's 10 years, we need to look at it again, and we're looking at what's more new and contemporary nursing education, concept-based, more interactive teaching and learning, different kinds of clinical sites because healthcare is changing, moving out of the hospitals. So there's lots of exciting things happening for us and for the nursing profession and healthcare. We've had lots of support from the Connecticut Health and Life Sciences Career Initiative, Robert Wood Johnson funded a statewide Connecticut Collaborative Action Coalition. They've been very supportive of us financially as well as in other ways. And again, because of a change in curriculum and the emphasis on educational advancement, we're looking at more enhancements to our articulation transfer pathways with our university college partners. So very exciting. Any questions?
Do you know how many partners schools we have?
Well, obviously all of our CSUs, except for Eastern, because they don't have allied health at this point. But we have, prior to BOR and BOT, we did reach out to every university in Connecticut. So virtually we have an agreement with everyone except UConn at this point. Because they don't have an RN to BSN program, they have an RN to MS, so it wasn't a great fit, but they are working on RN to BSN because of the national initiative, 8% BSN by 2020. They now, it's enrollment, let's face it.
Do we have successful students that graduate who, they want to get a 4-year degree? Do they go out of state? Can they?
Well, they could, yeah. I mean, they'd have to get a license to practice nursing in that state, but, and this is the kind of things we're going to learn from our database, is we believe that our students and graduates are grounded in Connecticut, they stay. They may, filter out to New York, Massachusetts, Rhode Island, but primarily our workforce partners rely on our graduates because they're not here away at school. They're committed to the state. So I think it's a great investment. So, thank you very much. Just contact us if you think of anything, you want our opinion based on our experiences, happy to help.